for being here for our Equal Partnership meeting. We are in lovely Fairbanks. For all those who are joining us virtually, we are connected statewide, which is why I looked at the camera, so everyone can wave and say hi to statewide folks. Today's a beautiful day in Fairbanks. We've got some nice warm weather. I know you all had a snowstorm earlier this week, but it looks like things are melting and spring is on its way. I feel like we can all be optimistic and hopeful for some warmer weather. So our partnership meetings are a great opportunity to connect with one another, for those who are providing services to children, youth, and families. For us to hear all the great things that are happening in communities like Fairbanks. I just see everybody connecting with one another. So clearly that means there's some great partnerships and connections here in Fairbanks that we can highlight today. So there's some really wonderful speakers, which I'm excited to share about. But before we get going, we wanted to highlight the fact that April is National Child Abuse Prevention Month. So I've noticed some of us are all wearing blue. This is technically Go Blue Day here across the country. And just to highlight the prevention of child abuse and neglect. I think with all the work that we're doing, creating safe, healthy, resilient families is important. We can do that with the Strengthening Families 5 Factors. We can do that by helping families feel resilient with one another. So in all of our work, I know that that's the main goal is to help create safe opportunities for children and to prevent child abuse and neglect. So without further ado, I'm going to turn it over to our wonderful Dr. Bruner for our welcome. And no pressure.
I'm Laura Bruner. I'm a pediatrician here in Fairbanks and lifelong Alaskan. I just want to say how excited I am to be here on a Friday with a room full of people thinking about kids and families in Alaska and how to help support kids and families in Alaska. So thank you for spending the time to be here. Thank you to the hospital for giving us space and IT support and lunch and water and all of those pieces. And I'm really excited to hear about some other things happening in our community. So I will turn it over to Tamar to talk about the All Alaska Pediatric Partnership a little bit, and then I'll be back to talk about FY25.
Hey, Laura. I wasn't expecting to stand up. I don't know why. Hi, this is me, Tamar Ben-Yosef. I'm Executive Director for A2P2, and I am not a lifelong Alaskan, but I've been here for 20 years, so it feels like I am. But I've been with A2P2 for not that. So a few announcements. We, A2P2, has been working with the State of Alaska Division of Behavioral Health on increasing linkages between providers to services for adolescent youth behavioral health. And part of that work is we are asking you all to share with us how you all are accessing services, what mechanisms you have within your practice, how you're not accessing services, but mostly we want to map out what the landscape is for access. And so this QR code will take you to a survey, and we would really appreciate it if you haven't already. Screenshot that, or just take a screenshot or something, or a photo, and we'll also share it and post it so you have access to it. Let's see. Symposium. If you have not been to one of our symposiums, we've been to the symposium. It's great, right? It's fun. This year is even more special because this year is A2P2's 30th anniversary. Exciting. So we're planning some special stuff for the reception and working on our presentations. If you would like to present at the symposium, we will have a RFP for proposals coming out a little later this spring. So November 14th and 15th is when the symposium is taking place. And Home Visitor Appreciation Week. Home visitors. We recently launched the Home Visitors Alliance in partnership with the Section for Women, Children, Family Health over at Public Health. And we really appreciate the work that home visitors do. And April 21st to the 25th is Home Visitor Appreciation Week. And so We're looking at ways that we can celebrate visitors, and you're all are welcome to find ways to do the same. Next partnership meeting, this is the last one for this round, so they go from September to May, will be in Homer on Friday, May 2nd. And that is my announcement.
Thank you so much, Dr. Reader, for the welcome, and thank you, Mara, for those great announcements. Before we jump in, I'd love to do some introductions around the room so that those who are on the call can hear who is in, who's here, and then if you're online, please feel free to share in the chat your name and where you're from. So I'm gonna start over here on this side with our A2P2 folks, and we'll just pass around the room, just your name and your agency that you're at.
My name is Robin McConnell. I'm a family support specialist here with Alaska.
I just introduced myself. I will say, please speak loud because the owl doesn't pick up quite as well over the end.
I'm Laura Bruner. The other part I forgot to say is I'm a board member for A2P2.
I'm Jessica Iser. I'm a pediatrician at Chief Andrew Isaac. Sammy Gilbert, program manager for the Youth Brain Injury Program. Amy Bagadish, the pediatrician here at FY25.
And I'm Naomi Pomeranz, pediatrician here at FY25. Sue Brosnahan, key account liaison for vaccines for GlaxoSmithKline.
Tricia Simmons, I'm the regional manager for the Office of Children's Services.
Wendy Nathan, I'm a staff manager at the Office of Children's Services.
Gwen Lee, I'm a pediatrician here. Hi, I'm Brent Ehlers. I'm a pediatrician here at FY25. My name is Melissa Wade. I'm a PA here at FY25.
Jim Harriman, I'm the clinical manager for AKPH, Job and Family. Here in Fairbanks.
Tracy Adams. I'm Tracy Adams, Community Services at Thread, Child Careers Resource Network.
Heidi Haas with Alaska Center for Children and Adults.
Lee Bolin with the Resource Center for Parents and Children. Sarah Hollister here representing United Way and the Fairbanks Wellness Coalition.
I'm Jeanette Gorda. I'm a public health nurse here in Fairbanks.
And I'm Shelley Point Anderson, and I'm the public health nurse manager at the Fairbanks Public Health Center.
So thank you so much. And my name is Brianna Honan, and I am the partnerships lead here at A2P2.
And we do have almost 40 people, 37 people online who've joined us, including a couple of folks from as far as Nevada. Hi, Tanya and Philippi, who are with Act for Kids in Nevada and wanting to learn about partnership meetings and the work of P2 and just in general how collaborations around closing gaps in care for kids work in Alaska. Thanks for joining us.
Well, let's kick off this meeting with our first presentation from Dr. Bruner.
Well, I was just talking with Tamara and reflecting on one of the things that unfortunately has become the way that I operate is at the last minute. It's not how I want to be, but it's unfortunately how I am now showing up in the world. And so this means that I did these slides last night. And one of the things that is really fun when I sit down and pull up the year before slides, and at the start, I'm like, what have we even done in the last year? Like, we survived. Right, like, I think we probably saw some kids and helped some kids and talked to some families, but have we even done anything else? That's how I went into this mindset. And it was actually really fun to think through it and see sort of some of the tangible progress that has happened. And some of the things that I'm excited to talk about. So thank you for forcing me to sit down last night and work on this and to think through that. As I said, I'm a pediatrician. I do see patients both in the Foundation Health Partners Pediatric Clinic and then in the hospital, and then am the medical director of some stuff on the screen. From kind of what we'll talk about briefly is kind of our inpatient and then some of our outpatient areas here at Foundation Health Partners. And that's what it's going to look like very soon with all the flowers. From a Foundation Health Partners standpoint, so I think many of the people here in the room know this, that the Greater Fairbanks Community Hospital Foundation owns the Foundation Health Partners facilities, so that the primary ones are Tanna Valley Clinic, Fairbanks Memorial Hospital, and our long-term care facility, Denali Center. And in 2018, Foundation Health Partners became the managing entity of each of these facilities. To talk about the All Alaska Pediatric Partnership, so somebody asked me the other day if we just joined the All Alaska Pediatric Partnership last year, and I was like, no, it happened when I was like in high school or in the elementary school or something like that. So I think it's really a long-standing partnership and really excited to continue to be a part of the All Alaska Pediatric Partnership. And one of the things that really energizes me every time that I get to hang out at an A2P2 event is, you know what, there's so many people who care about kids and families. And there's so many things, every time I go to a meeting, every time I'm in a room, that I'm like, wait, you're doing what? Tell me about that. I didn't know about that. And then I get the chance to see a family, to talk about it, to share the good work that all of these entities are doing. And I never stop being amazed at the work that is happening in this community and in the state with helping kids and families. So I get excited about it every time, and I leave with a giant to-do list and I get a part of it done. From an inpatient standpoint, so here at Fairbanks Memorial Hospital, we do not let the children program the IV pumps, but I could not take this picture. That from a nursery and NICU standpoint, we have somewhere around 1,000 deliveries per year. That goes up and down in different time periods. Bassett Army Community Hospital is somewhere around 360 deliveries a year. We do have a level 2 NICU here in Fairbanks. It is the only NICU outside of the Anchorage area right now. And so as we think about volcanoes erupting, that is an important thing for medevacs. So I'll just put that out there for those of you from Anchorage, please don't let the volcano erupt. And then we do have an in-house pediatric hospitalist service. So I know some of our pediatric hospitalists are here today. What that means is that there's a pediatrician in this building to see kids in the emergency department, babies that are born in the NICU in the pediatric settings all the time. And that's a really cool thing for clinicians. That's not something a lot of community hospitals have. What it also means is when we are on call and it's 2 a.m, we are the pediatrician serving all of the children in an area somewhere around the size of Texas. And so that gets a little intimidating at 2 a.m. and I'm very grateful to my colleagues who do that work. Our pediatric unit, so it's an 11-bed unit, and we do every once in a while overflow into the grown-up area when we're like, oh, sorry, it's gonna be a kid over here crying. We do have the ability to do that, which is lovely. We have pediatric trained nursing staff, which I cannot tell you how invaluable that resource is when they say things to me like, would you like to put the IV in? And I'm like, I don't know how. Please help me. They are wonderful and they are fabulous. And I feel very, very fortunate in a community this size to have that resource specifically for children. Lots of quality improvement projects always ongoing. Thank you for Dr. Cartagena for always bringing those to my attention and being like, I got a really good idea, let's work on this. She does, and we do work on it. Again, we've talked about the staffing a little bit. We do not have a PICU space here in Fairbanks. So the PICUs in the state of Alaska are both in Anchorage. PICUs are pediatric ICU care. We do some pediatric ICU care here because if the kid walks in the door and needs PICU level care, we provide that care so we can get them to Anchorage. Celebrations. So one thing that was really fun, there is a national designation called Emergency Medical Services for Children. We do have that certification here at FMH. They come and they go through your charts and they ask you questions and they look through kind of the quality improvement work that you've done. And it was really fun when they came and they started asking us questions to see our emergency department nurses so excited to talk about kids. They were like, we have a kid cabinet and look, it's purple and look, we have this and all the tools. And it was really fun to see the enthusiasm from that team of really embracing the pediatric work. There are a number of committees through EMSC and the trauma committee that look at our cases here at FMH. We'll talk about visiting pediatric clinics a little bit, and many of you have crossed paths with over the last year at some of the behavioral health work, and I'm really excited to talk about that. And then statewide collaboration with other hospitals. So some of this in Alaska, you guys all know this, you live and work in this space, is not the formal collaboration. It's the text a friend, hey, what are you guys doing with this? Hey, do you know somebody who could help me think about this? And as I talk with colleagues in other areas, that doesn't exist everywhere. And it's really lovely to be able to shoot a message to the other pediatric medical directors in the state and be like, can I borrow your brain for just a moment? And be able to share that in a really collaborative fashion. So I am just continually grateful for that. Outpatient facilities. So this is the big news in the last year. The Tanana Valley Clinic pediatric space, which is over there on Noble Street. moved. So we are in this space now. So if you go up 3 floors straight above us, that is where the Foundation Health Partners Pediatric Clinic is. So many of you are providers in our pediatric clinic space upstairs. And we do still have patients show up at the Tanner Valley Clinic space and we're like, nope, come on over to the south building. The benefit of it is really sort of that moving clinical space all into one campus. What that means is you can share resources, you can share supply chain, and you can share staff, and you can move patients more easily back and forth. For those of us lifelong Fairbanksans, it's really hard not to head to Noble Street and to the Tanana Valley Clinic for care, and so there's a learning curve happening with that. Speaking as a clinician, it is lovely to be able to be on the inpatient side and have my outpatient colleagues call and say, hey, I think this kid needs to be able to, or needs to come into the hospital, and to go 2 floors to do that instead of an ambulance to do that, and to be able to move kids into that space. So growing pains and change is hard, but I think in the long run has been a good thing for our kids and communities. The other thing that we'll talk about here in just a second is the visiting clinics. So visiting clinics, we do have a visiting clinic space here. So I said the pediatric clinic is 3 floors above us on the 4th floor. The visiting clinic space is 2 floors above us on the 3rd floor. So it is a designated space that we have available for other clinics to come and use that space. So on the FHP side, we do have our pediatric team. We do have an allergist. We do have a child and adolescent psychiatrist in the behavioral health clinic at FHP. And then we've got these amazing pediatricians and PAs and nurse practitioners that are seeing kids in this space, and then evening and weekend hours. So thank you all for working Saturdays and Sundays. From a visiting clinic standpoint, that we've really had some great support from the Foundation Health Partners executive team and leadership team on this, of really recognizing what a big deal it is to go to Anchorage. So if you have to go to Anchorage because you have to go to Anchorage for care, oh my gosh, we do it. But if it's a 30-minute follow-up visit with a cardiologist or a 15-minute visit with a urologist, it's really hard for myself, for a family to get to Anchorage in under a day and under $1,000, right? By the time you fly or you drive and you eat and you get the kid there and you get the supplies, and if you're taking that time off work to do it. And so the idea of being able to have visiting clinics and bring those providers here, family can go to school for part of the day, family can go to work for part of the day. It's really been, we hear from our families again and again what a big impact that is to be able to have clinics in their hometown. Currently, these are the clinics that are coming up. The biggest couple additions. One is the Alaska Pediatric Specialties team is bringing up their surgeon on a regular basis. We're working on gastroenterology. We're trying, it's coming, but I think that will be very exciting. And then the Aspen Pediatric Endocrine Clinic from SCF is coming up and doing pediatric endocrine clinics here, which has been life-changing for many of our families to have access to care right here in town for that. The Behavioral Health Summit. Oh my gosh, I get like rapid pressured speech and get all excited when I talk about it. So this, I have to give credit. She's not here and she's not listening, so I can talk about our to our CEO, Shelley Ebenall, who really probably about 1.5 years ago had myself and our chief nursing officer in the room and said, we got to do something. We have to do something. We know that we have an adolescent healthcare crisis in our state, in our country, but also really in our community. And that she was hearing from staff and from families kind of continually about the impact of that on kids, the impact of that on families, and honestly, how much our staff are seeing those children in the emergency department and feeling like they don't have the tools to help those families get better. And so she has organized these meetings. She has continued to support and fund and coordinate and kind of all the logistics that all of you know go behind a big meeting. And it's really, we're 1 year into doing these meetings, just over 1 year into doing these meetings, and has really kind of now morphed into a quarterly meeting. And so what that means is 4 times this year, we have a calendared meeting. It's a whole day meeting. The next one is next Wednesday. I'll be doing the slides the night before for that as well. Thank you very much. And it kind of, the first part of the meeting is really fun to listen to updates from different agencies. So a number of you have been there that you get to hear about, oh, wait, I didn't know you were doing that. Oh, that's really cool. Do you need a letter of support? Hey, have you tried this? Hey, have you thought about this? What's your phone number again? All of those sorts of things you see happening in the start of the meeting. And really the focus is on having decision makers in the room. So you've got CEOs and CFOs and clinicians that are sort of at the decision maker level for these entities in the room, so that really you can get information and not have to say, oh, I gotta take it back and think about it. Oh, I gotta take it back and talk to people. And it's really been a really cool thing to see. I'm gonna just celebrate for a minute. So many cool things happening. This is not in any way meant to be an all-inclusive list, but when we started this work, one of the things we really identified was kind of the gap in services. We have lots of preventative services, we have lots of resources, and then we have inpatient hospitalization in Anchorage, and kind of thinking about the spaces in between there and how do we build out that continuum of care. So Alaska Behavioral Health has a partial hospitalization program in Fairbanks for adolescents that's open and seeing kids right now. That is so cool. Thank you, thank you, thank you. That did not exist a year ago. The Fairbanks Native Association announced this last week, their opening of their day treatment program for adolescents here in our community. They have a patient enrolled who's able to receive intensive behavioral health treatment at home, sleep at home at night, get services during the day. That is a life-changing opportunity for kids to access services in their home community and stay integrated with their family and their community. And at TCC, Graft has opened residential treatment again here in Fairbanks. So again, working to have a continuum of care and options for kids in town. We will never have every service that every child needs here in town, but really looking at where can we provide those services. And so I just want to say, none of those have anything to do with my employment, the work where I do, the work where I am, but I am so beyond grateful to these entities for stepping into this space and doing this work. The part that FHP is doing is the acute inpatient piece. So what a hospital is good at doing is being a hospital. And so while we can't fill all of those other gaps that we talked about and really relying on our community partners for that what FHP is doing is really looking at that inpatient, so that highest level of acute care for adolescents. So this need has been brought forward a number of different times. Many of you have participated, heard, and answered my phone calls and emails, thank you, related to fundraising, and FHP is committed to building an adolescent inpatient unit. We are gonna need partnerships with everybody in this room, so it is 4 beds. 4 beds is 4 beds. We all know it's only 4 beds. That is what we have space for, that is what we can fit into our existing space here, that is what we can fundraise, and that is what we can keep sustainable. So in order for those beds to be used for the kids who need acute inpatient care, we have to be able to have other access to resources, right? So if you come in and you need acute inpatient care and get better, I'd love for you to be able to move to the partial hospitalization program if that's the next thing you need, or the day treatment program. And so that you can flex up and down within that continuum of care, that if we can't help kids get to the next level of care, 4 beds serves 4 kids. And so we really have to be able to work with the entities in the community to move kids through the continuum of care to meet their current medical needs. Because the other thing about a hospital is it's not a great place to be if you don't need to be in a hospital. So I love it when kids are able to leave the hospital and go to other places, because that means they are doing well, they are thriving, and they don't need to be here. And then our current work, so this week I've had 2 or 3 meetings looking at what's called programming. So that is great, you're a kid, you're here in the hospital. What do we do to help you get better? What are the things that happen in your day? What are the tools that exist for you? And so looking at kind of all of those different pieces, and it's been humbling and a really fun adventure to sort of learn about that space, and have had great partnerships with some of the entities in Anchorage and then some of the Seattle entities to look at what they're doing and what's working well. And my favorite question is, what do you wish that somebody had told you before you started doing this? And have gotten a fabulous range of answers that we're attempting to learn from. This is sort of the idea of the continuum of care. So those of you that have looked through the AHA report on adolescent behavioral health will recognize this image. This is the idea of kind of over here, this is safe and stable homes. So this is things like family and friend assistance, peer support, crisis call line, those sorts of tools, crisis stabilization, residential, in-state psychiatric, and out of state residential. And then over here is inpatient care. So the sticky notes on here were all put on by different entities of what are they doing in each of those spaces? Where do they have service lines? Where do they have availability to help families? And so this is the space that FHP is working on. And these are, again, I'm so excited, you guys. These are some of the things that have been filled in over the last year by other entities. So always more work to do, always more opportunities to help, but really exciting to see that in our community. I will just mention the pediatric residency, because I love to give a shout out to this program. So this is the Seattle Children's Residency Track. So right to become a doctor, you go to college for a lot of years, then you go to medical school for a lot of years, and then you go to a residency program specific to pediatrics. And we here at Foundation Health Partners are a site for the Alaska Track Pediatric Residency. Thank you, Dr. Lieb, for being the director of that program locally. What that means is that we have a resident here with us who gets to ask us questions when they're like, did you think of this? And they're like, no, please tell me more. And so they help us continue to learn, and then they get the experience of being outside of Seattle Children's Hospital and seeing what pediatric medicine looks like in a different location. So large success rate in terms of return to Alaska. Really, the idea is providing residents the opportunity to see how cool and awesome and fun Alaska is, so then they want to come back here and work with us. Areas of need, so this is the theme, right? All of us are in need. We have certain specific specialty areas that are really hard to recruit to, really hard to receive specialty knowledge in and continue to staff. Coordination of local resources, so lots of conversations recently around how do we know what's happening at each entity in the community and share that information. Shout out to Help Me Grow, you have folders in front of you, and I hope I'm not spoiler alerting, but thank you to the FHP pediatric team who is referring lots of patients to Help Me Grow. And that's really awesome and great to see. And then pediatric subspecialty care. So we touched on this, just the impact of needing to travel outside of your home community for an appointment and what that means for patients and families and how they access care, and some of the choices that then families have to make around travel and cost and care for their kids. So those are kind of our continued areas of focus in addition to the behavioral health work this next year. Questions, comments, concerns? What did I forget?
Question here, actually for the partial hospitalization program, does that include treatment for disorder?
Yes and no. We do have a partial hospitalization in Anchorage, and we have a IOP for eating disorders that serves into that program, but not here at Fairbanks yet.
And then, I don't know what this was referenced to, but there was a whoop whoop to something you said. And a message from Erin Moya over at Seattle Children's letting us know that they filled all the Alaska Track residency slots on match day.
Yay, very exciting. All right. Well, reach out, questions, concerns, and really truly appreciative and grateful for the collaboration in this room and the feedback and partnership from all the different entities there.
Thank you so much, Dr. Bruner. That was an incredible presentation. Lots of great things, and I just appreciate, you are the people's partner, and I just love that because you lifted up so many people in this room and just highlighted all the incredible work. So thank you for all that you do, and again, everybody in this room. So I'm gonna turn it over to Lee with RCPC.
Hi, everyone. So the amount of information in these slides is disproportionate to the amount of time. So I'm gonna go a little quick. I can send these to anybody. I also have brochures, our website's full of information. So if I move a little quick, it's just. Okay. Our mission is to create a culture that values parenting and keeping children safe. We've been around since the 70s. Started as a group of concerned citizens to want to prevent child abuse and to strengthen the family structure in Fairbanks. Currently, we serve not just the Fairbanks North Scarborough, but also the entire interior and the North Slope. These are our services. I hate how that space happened. Stevie's Place Child Advocacy Center. We have a behavioral health program, family services, and then outreach. So this is Stevie's Place. Stevie's Place is a child advocacy center model. That model started in Huntsville, Alabama in the 80s, where a prosecutor was like, we have to do better for kids. And so really, instead of the child who has experienced maltreatment having to go to the emergency department and the police station and child welfare, they can go to one spot where everybody gathers around the kid. So we are located, all of our services are located on 26th Avenue across the street from the food bank. We're in the same building as the Interior Alaska Center for Nonviolent Living. We at RCPC, Stevie's Place takes up the whole back half of the building. We have a medical exam room. We have a contract with Fairbanks Memorial Hospital. We pay $40,000 a year for 24/7 forensic nursing care, which I feel is a really good deal. And with that, those nurses are trained to work with both adults and children. And so we call them, they come over, and the medical exam room's the bottom left picture. So they can do everything that they need to do, whether that's evidence collection or just a checkup with a child. They do a lot of immunization, referrals, vision, dental, mental health. We just started, we saw a need when it came to trafficking that we weren't as responsive as we could be. And so we worked really closely with our forensic nursing team and with FMH to create a trafficking screening tool. And so that's now being implemented here and at Stevie's Place. If we ever see a kid that has risk factors, which is awesome, and we have caught some trafficking risk factors with that. Also, the nurses do a PHQ-9A, so an adolescent suicide screening for all kids 11 and up or under 11 if we're worried. We also work really closely with law enforcement, whether that's troopers, North Pole Police Department, Fairbanks Police Department, North Slope Borough Police Department, and then any of the smaller police departments like Galena or Fort Yukon. We work with the military part. I could just keep going. District Attorney's Office, OCS, Tribal Partners, Chiefs Conference. We work really closely with their Tribal Social Services program, also their behavioral health program, also Alaska Behavioral Health. So everyone I just mentioned is part of the multidisciplinary team. We come together once a month, review cases, talk about ways we can better help families and children, any ongoing services that might be needed, all the way through either their OCS case or their criminal case, whichever may end first. We also have people that don't need our services, they come back needing our services. We're just there for anybody that's come through Stevie's Place to help. We see state statute requires us to see allegations of child sexual abuse. We also see felony level physical abuse, witness to homicide, or threat of life, typically domestic violence. And Stevie's Place serves between 300 and 400 children a year and their non-attending family members. So we work with the whole family, making sure that the kids are safe. We have a small behavioral health program, one clinician and me, providing clinical supervision. And we're really focused on children who've experienced traumatic events. So if they did have more mental health needs than working on trauma, depression, anxiety, we would send them to Alaska Behavioral Health Team at Chiefs Conference or somewhere else in the community. We really focus on working with the whole family when possible, and we're evidence-based. We work with, we have staff trained in TFCBT, AFCBT, eye movement, desensitization processing, EDR. And then we also just started a group therapy, weekly group therapy sessions for families whose children have experienced sexual abuse, which has been awesome because that just feels so isolating and alone, for them to come together and have a group has been really great. I think they've met, this week will be their 4th time, so it's going well. And then our family services program. So this is a lot of different things all under one umbrella. Family support is our walk-in service. I had surgery yesterday and I feel weird just like standing here. Walk-in services. So anybody can just show up. Last year we had like 900 walk-ins. Nat down here, I staged him. This wasn't real, but he's looking at diaper sizes for a family in need. Peggy, we got a grant through Golden Heart Community Foundation to install, so she's a certified car seat installer. And so someone that needs car seats, we install them in their car, make sure they understand how to keep their kids safe in the car seat. So we just whatever we see a need, we really try to fill it with family support. So honestly, you can just send people to us and we will help them. We have grandparents show up that are like, I just started taking care of my grandchildren. I haven't parented in 20 years. Help me. People that are pregnant and they're like, I don't have anything for this baby. Like we have diapers, we have wipes, we have formula, we have baby bathtubs, we have back and plays. I mean, we get a lot of really awesome donations from the community. And so we also can do parenting coaching, case management, referrals, things like that. And then this is also, if you hear of us having breastfeeding resources, we have anything one could need to support the normal breastfeeding experience. I say normal breastfeeding experience because we do not have an IBCLC, so we refer people over here to Chief Andrew Isaac if they're having any issues. But we do have pumps that we can give out or loan. We do have bras and breast pads and all the things that come with breastfeeding. They're all room full of stuff. So if anybody's in need of resources, you can send them our way. Family Contact is a supervised visitation program. We do parent coaching, case management. This is our family contact room down here. If you notice, there's a keyboard in the middle. When I went to take this picture, that keyboard's not usually in there. When I went to take this picture, they were setting up for a visit because they have an older teen who's visiting with their parent and they play music together. And we happened to get this keyboard donated, so they stuck the keyboard in there so they could play it. So we really try to adapt, so it's not like a little kid room or, you know, a teenage room, but kind of whomever might need those services is in there. And we'll work with them through the duration of their OCS involvement. But really the goal of that program is to have quality family contact so that the family can have a really solid visit. Parents can learn about child development, appropriate discipline practices. We have a lot of parents that just don't want to experience parenting, and so we're there to help them do that. Then we have our Circles of Support program, and that's a home visiting program for families that have OCS involvement. So that's where the children are living at home, but there is OCS involvement. That could be at the very beginning of a case when an investigation just started. We can, especially with Stevie's place, we can just refer someone right away to get them into Circles of Support. Or let's say they went through our family contact program, or they've been through OCS for a while, and now the kids are starting a trial home visit. We can be there at the end to make sure they have everything they need. We also just got a grant from the Fabulous Feminist Fundraisers to get safety items. So whenever your child is having a trial home visit, you have to, you know, make sure everything's safe. So like outlet covers for the outlets or doorknob thingies that make it hard to open. You need a baby monitor that has sight and sound. So sometimes that's a barrier for our families. And so we have those items too, so they can have a successful home visit. Also, the mother's milk bank, I said this here, I didn't know where else to put it. I just put this in here because we get a lot of calls where people want breast milk. We're not giving the breast milk out. We are taking it and sending it to Colorado. So if you have someone that is like an overproducer and they want to donate breast milk, or they're not breastfeeding anymore, but they have a freezer full of breast milk, they can send it to RCPC and then we send it to the mother's milk bank and they process it and distribute it to hospitals across the country. But we don't give out the breast milk. And so it is not a part of our breastfeeding services that we have. And then we do a lot of outreach. All of our programs do outreach, all of our staff do outreach. The outreach really can depend on what is needed. We have we do a lot of outreach like this today, where like we're talking about just what we do. We do mandatory reporting for tribes, schools, community agencies. A lot of, you know, what's the needs in the community. Last week I got 2 calls. I got a call from Tanana Valley Middle School, and I got a call from the Church of Jesus Christ of Latter-day Saints, and both are wanting presentations on internet safety for teens, which is a huge buzz right now. So really, if there's a need in the community, we have a lot of presentations already prepared. We'll work with different entities to try to make something that fits for what they're trying to talk about. We have an online safety series. If you go to our website, and the next page is a copy of our calendar. You can see the different classes that we have. So through our child safety series, we have, you know, what is a child advocacy center? What do I do if a child discloses to me? We have one on trafficking. We have one on child sexually acting out. A lot of different topics. They're all free. They're all via Zoom. We do a lot of body and personal safety information out into the communities. I really like this picture. This was taken last weekend, and Tanana, we were out there doing community outreach. I just like, that's my outreach person's son, but he's engaged. Okay, and then we've incorporated opioid education into all of our outreach and family support work as well, because we were seeing some worries with that. We also partner with agencies on specific topics. So we partnered with public health to do a Start the Conversation, which was a class. I called it Sex, Drugs, and Rock and Roll, but they told me I couldn't call it that. But it was for teenagers on like how to talk to your kids about sex and how to talk to them about drugs. which was really good. And that was with Public Health and Interior Aids Association. And then we also did a class with Little Kitchen Academy, called Little Kitchen Academy, that was with Breadline, where we just went to the food bank and got a box of food. And then Chef Maria at Breadline like opened it in real time, and we're like, what do we do? Because you get food that needs cooked in those food boxes. And so my favorite class we ever did was like, what do I do with all these beans? Not everybody knows how to cook beans. So yeah, anytime, if anybody, wants to be creative or have any ideas of things we could do, we love to partner with other agencies and have classes like that. So yeah, this is March, so go and look at April now, but this is just kind of this different stuff that we have on our website of the different classes, different outreach events and things like that. Upcoming events. So today is like official Go Blue Day, but we had a lot going on, so we pushed it off to next Friday. So we're gonna have an open house next Friday where you can get a tour of the agency. We have snacks. At noon, we're gonna have a little ceremony honoring Scooter Welch, who was the executive director before me. He passed away last August. And we'll have resource tables from a lot of different agencies. Some of the agencies here will be there. It's gonna be really great. And then my staff wanted a spirit week, so they picked the days. We're gonna have a spirit week. So Monday is 80s Day, Tuesday's Jammy Day. Then we have Fandom Day and Tie-Dye Day. And then our Mosquito Man, our annual 5K is June 14th, save the date. And then we also are the Alaska Yoga Festival's nonprofit that they're supporting this year, so July 11th and 12th. And then next Tuesday, I'll be speaking at the Chamber of Commerce meeting. And this weekend, we're gonna be at the Women's Fair. So stop by our booth, because we have a table. And that's it. Does anybody have any questions?
So, you guys do so much, not so many questions.
I was like, well, thank you so much for your time. I appreciate it.
Last year when we came up for our partnership meeting, we were able to go take a tour of RCPC, and we spent 2.5 hours there just checking everything out. It's an incredible facility, the most welcoming, loving staff members. I felt like they were my friends just from the day that I spent there. It was just so incredible. Like, we just kept going and going, and there's so many cool rooms. So thank you for all the incredible work that you all do. And Help Me Bro will be at the Go Blue Day event, which is super exciting. So with that, I'd love to introduce Heidi Haas from the Alaska Center for Children and Adults.
I too have more information than time.
Take your time.
Don't. I'm gonna set my timer because I can go too long, so. Hi, I'm Heidi Haas. I'm the Executive Director of Alaska Center for Children and Adults. I love highlighting our wonderful team. So every opportunity I get to do that, I like to share us. I think this was just this past fall, but we do try and do a Go Blue picture every year. We also highly celebrate Autism Awareness Month, so we wear a lot of blue in April. I'm really actually excited to share, this is the first time we're sharing our new mission. We just went through a strategic planning revamp, and so I'm gonna say it, first time in a room to a room full of people is ACCA improves the lives of individuals experiencing developmental disabilities, delays, and mental health needs regardless of income throughout their lifespan. And I'll talk a little bit more in a minute, but that's a huge revamp from what we've been doing in that we are entering the mental health space, which is an exciting piece for us. Again, I don't expect everybody to read this, but a list of all the different positions that we have that are serving this region. I heard Dr. Bruner say about the size of the state of Texas, and that is also the case for us out of our little beginnings at 1020 Barnett Street. So we have the FASD diagnostic team, which is the light blue and serves the whole northern part of the region. We have our DDRC, which is one of our main programs, but you can see serves the interior, but also all the way to the North Slope and out to the Canadian border. Our infant learning program, which serves this Fairbanks North Star Borough area, and then all the way down to the Copper Center area. And then our child and family wellness program and loan closets just serve the Fairbanks North Star Borough. We're hoping that our child and family wellness will be able to expand. So our infant learning program in a nutshell is our birth to 3 kiddos. So thank you pediatricians who refer to us. We love you. It's so great to actually see some of your faces because I see your names in the referrals often. But birth to 3 kiddos who are experiencing developmental delays or disabilities. We also are under mandate that we provide an evaluation for any child who has had a substantiated report of harm from the Office of Children's Services. So we do work with a lot of families that have had protective service involvement. The really interesting part about infant learning program is that we want to make sure people know we only have 45 days to do our evaluation process and actually enroll a child if they are eligible. And so that is, to me, a very fast calendar, obviously, because it's calendar days, not office days. But it highlights the importance of that early intervention piece and how quickly children develop. We also always like to make sure that everyone knows that whether you think a child may be qualified or not, because our state does have a pretty high qualification level, that we go ahead and refer them, because even if we aren't the right resource, we are happy to do an evaluation and we are happy to help those parents get those resources. We also do a lot of transition services of children right before they turn 3, if they're still qualified for services, then they transition to the school district, and we help them with that process, and we help those families work through that, which can be a really intimidating piece to having a child with a developmental delay or disability. So our DDRC, which is the program that serves kind of so ILP, serves, we serve the Fairbanks North Star Borough Copper Center, Delta Fort Greely, and then we also serve the North Slope through ILP. So for those of you across the state, there is an ILP that covers every single square mile of this state. So if you aren't in one of our regions, there is an ILP available. Our DDRC, there are also DDRCs across the state. So we really are that first point of contact if someone has a disability and they need some additional support. We're also the organization that'll help families that need additional support that's provided through the state of Alaska through what's called a waiver program for those intensive disabilities or medical needs. And so we become that entry point for those families. But we are really hoping to expand our scope with this program and really be able to just be the resource for disabilities, for kind of children. Like, we don't do it all, but we can tell you where to go. And so if people can be able to call one person or talk to one person, I know there's lots of different like statewide pieces, but sometimes on a local level, it can get a little bit challenging to always be able to know what the resources are. So that's a program that we're hoping to continue to develop. Our new program, which I'm so excited about and really kind of mirrors some of the other conversations, is our Child and Family Wellness Program. So we received a grant through the state of Alaska to lift a new mental health based program for children birth to 17 and their families, and really focusing on children who have disabilities, because often that can be a barrier to services, and then those with Medicaid, because that can also be a barrier. We are pretty limited in the resources for Medicaid families, and often those two groups coincide, and so we're really looking to lift those families. It has been a much bigger process than we anticipated, and we are going through the process. We have to become licensed with the state and all of these pieces. But we have some great community partners like Lee at RCPC, who's been helping us to get ourselves into a position where we had hoped to already be starting, but hopefully by late summer, we'll be able to start seeing families. We are already providing a lot of infant early childhood mental health services through our infant learning program. And so what our vision is to be able to provide that continuity of care that Dr. Bruner also talked about, with kind of the focus of infant learning, which is to meet families where they are, be able to do home visits, be able to support an entire family, not just an individual person, connecting with resources, and then helping them kind of follow through with wherever it is that particular kiddo and their family needs. So it's a work in progress. It's a lot of work in progress, but it really is a needed program that we feel like we have the capacity to build. So within that program, we still have the fetal alcohol diagnostic team, and Dr. Carter Haynes and Dr. Lieb have been a part of that. So we're still serving that population of kiddos who may have a suspected or diagnosed FASD. And then we are providing the infant early childhood mental health services in collaboration with our infant learning program, and then lifting a clinical piece so that we'll be able to provide the clinical services as well. Which I just talked about. I forgot that I had this separate slide, so. And then we have a really tiny little program that we love. It's our baby program that we call our Of the Heart program, our loan closet program. So we loan out adaptive mobility equipment. We do not have things like beds or toilet risers or tub seats, those types of things, but we have the mobility. We have wheelchairs and walkers and knee scooters. FHP donated actually a lot of knee scooters to us when they condensed their program. So we have a lot of knee scooters, which are very helpful this time of year. Unfortunately, this is the time of year where almost all of our stuff goes out because of the ice. So it's very, very affordable. We have like a $10 deposit, or we have a deposit, but it's then a $10 cleaning fee. You can get your deposit back. About $50 or $60 for a 3-month rental. So it's very affordable. We really try and work with the community to be able to have those items available. We do not need any donations right now. We need to find place because we keep getting crutches. We have an abundance of crutches. So and then really one of the pieces that whenever I present, I just say like ACCA may not be the service that an individual needs, but we would love for you to be able to contact us if you aren't sure where to turn, and we'd be happy to help find that service. Because while we are only able to help kids that fit within our kids and families that fit within our grant guidelines, we are connected with all of the, I mean, it's like crazy looking around this room, right? We are connected, and we're connected in the other regions that we serve as well. And so we really want to be that partner for children and families that can to get people to the right place, even if it isn't the service that we are able to provide. So that's our contact information, and I think I did it.
Are there any questions or anything?
I don't have a question, but I just want to share that current legislative bill
Thank you.
that is intended to increase eligibility for a learning program by lowering the threshold of eligibility from 50% delay in the domain of development to it's a little more complicated than that, but even it's about to 25% delay, which is what most states in the country are at, and Alaska is maybe one of two, I think, that has a 50% delay requirement. So advocate, letters of support, all the things, testimonies. Senator Tobin's office is, I think, sponsoring on the Senate side, and I believe that Representative Fields on the House, but I can confirm that.
I think you're correct. So, yeah, it's a moving situation, and one of the pieces to that I'll just check on since you brought it up, is that it's really Alaska is the most restrictive in the country for eligibility, which I know is a huge frustration. I'll say to our pediatricians, especially. It is for us as well, but also it aligns with school districts. So if a child just before 3 doesn't qualify with a 50% or with a 25% delay, the day after they turn 3, they will qualify for school district services. And that's a huge gap, and we're missing a lot of kids. And really the idea is that if we can get a hold of those kids before they turn 3 and serve that additional 25%, then we would really be able to make a huge impact in their lives. So it is, we've got movement, it's exciting. I will say that I am an IOP parent. I had a child who graduated from IOP, and my first experience of going to Juneau and advocating was for the change in eligibility from 50 to 25%. She's now 21. So it's time. I'll leave on that little advocacy note. But
the other part of that bill is also that it calls to get Medicaid reimbursement for all developmental therapies as opposed to just motor and speech currently, right?
Yes, which is a huge piece because none of our developmental therapy services our special instruction, specifically by qualified, their special education teachers are able to, we're not able to bill for those services. And then our OTPT speech rates are only billable, like we're a clinic. But because we provide all of those homes in a community or home-based setting, there's a disparity in travel and time and all of those things. So, yeah, thank you, Tamara. I appreciate that. IOP is such an important piece to the kid in early intervention, but we definitely have some work to do on the state level. So, thank you.
Thank you so much, Heidi. Yes, I love the thing about ILP is you have such wonderful partners all across the state, everybody. As you said, every 4 mile is covered, and so you have so many wonderful, happy helpers who are also screaming from the rooftops for change. So, thank you for all you're doing here in this large part of the state.
Hi, everyone. I'm Jess Geiser. This is my first time at A2P2 and I get to present. So how cool is that? Thanks. Yeah. So I'm over at Chief Andrew Isaac, and so I'll just be going over a pediatric overview. There. So this is our team. Dr. Eliana McKee is our team lead. She is the yellow crayon in the top, and she's Nemo in the side and bottom. She's been with TCC for about 5 years. She's fantastic. We also have PA Holman. She's been with us for 13 years. So she's just like a wealth of information. She's wonderful. If you need to know anything ever about TCC, she's the person to go to. Sorry if you're listening, Steph. But she is, where is she there? She's the blue crayon, and then she's the jellyfish. And then there's me, I'm Ursula on the side. I've been with Chief Andrew Isaac for 6 months now. So I'm like the newest member of the team. I've been in Fairbanks though for 5 years. I was active duty Army for 11 years, and my husband and I both got stationed up here in Fairbanks. We had a daughter, we bought a house, we fell in love with the community. We're like, yeah, we're staying. So we both got out of the Army and we laid down roots here. And then Sarah Reed, she's our nurse practitioner. She's in the bottom left of that picture. You can't see it, it's a really cool scrub shirt with a bunch of like fish and bubbles and things like that. She was in the urgent care as an RN for about 2 years at Chief Andrew Isaac, and then she's like our newest provider, 5 months. So she came on just like after me, but she's been at Chief a little bit longer. We're currently co-located with our CMAs and our care coordinators, and then each pediatric team member is integrated into one of 3 care teams, Dunedin, Tootie, and Tacoma. And so we have family medicine providers, internists, like who are on our team, OBs, so we coordinate with them a lot. And then, oh, Steve J, I almost forgot to mention him. So Steve J, wonderful man, he is still with our organization. He's the guy with the orange crayon on top in the very center of that top picture. He really wanted me to do a morphing picture where like he turned into me because I am the new Steve J, although no one can ever replace him. But he's our subspecialty care coordinator, so he's still at Chief Andrew Isaac. Cool. So this is the region that we serve. And so this on the right is Alaska superimposed on the lower 48. Isn't Texas cute? And then within Alaska, that little black region there, that's the area that we serve. So it's 235,000 square miles of interior Alaska. It's about like 37% of the state. So just under the size of Texas is the area that we serve. It's pretty big. And we added Anaktuvuk Pass up there because our little, we also serve that region. Dr. McKee goes out there. All right, so we have a clinic mission. We're just clinic. So we rely on our wonderful, hi, Dr. Bruner and staff here for the inpatient side of things. We send you guys a lot of kids. We medevac some in from the villages, and we really appreciate you guys for taking care of the inpatient side for us. For our clinic mission, we do well checks, we do acute appointments, telehealth appointments. A lot of our
patients, of course, are in the villages and subregions, and so we rely on telehealth a lot, because it's a lot of travel back and forth for the families. We try to minimize that as much as possible for them. And so we do have a lot of telehealth availability. There's always a pediatrician on call. So 365, 24/7, we are accessible to our patients. And that is for the villages and subregions. We have an urgent care at Chief Andrew Isaac, so we're always available to them. And then other providers at Chiefs, our family medicine colleagues will reach out to us frequently, as well as our OB and then outside providers. When we're a primary call, that's the villages and subregions plus urgent care and then other providers. And then when we're secondary call, that's when we're not taking call from the villages. The family medicine colleagues will do call from the villages during that time. And then Margaret just entered the, yeah. Just kidding. And then for our village calls, sometimes there's a health aide. I think the village mission is kind of the most interesting part about what we do. So I'll talk about that a little more, and then feel free to like jump out and ask questions. I just have a bunch of pictures on the slide versus text. But yeah, the village is the most interesting. So we travel via plane, bus plane or like commercial boat sometimes, snow machine, or if our subregions, like it's on the road system, so Tote will just drive there, Nana we drive there. But we travel via a variety of all sorts of different means to get to the regions that we serve. Sometimes there's a health aide in those villages, other times there's not. So if we're taking call and we get a call and there's a health aide there, it's very nice, it's very algorithmic. So we have a training program that CHAT puts forth where we train all of our wonderful health aides who are individuals from that community that they feel the need, they feel that like call to serve, their population, their friends and their family members, and they are on call 24/7 for them. Usually there's just like 1 or 2 health aides in that community, and they'll get their door knocked on at like 2 a.m., from their cousin or their neighbor down the street, saying, that their kid tripped, fell and hit their head. And so they're a fantastic resource. So sometimes we have a health aide, we're lucky enough to have a health aide, but there's a lot of villages that are not, that we don't have a health aide for. And so sometimes we're talking directly to the parents themselves. And so we have to determine whether or not we're going to medevac a child based on the information that we receive from that parents or from that family member. So that is our villages. And then we're focused on like a big thing that we're doing now is immunization campaign and drive, especially the resurgence of measles. Any questions on that? Just like open it up to village and other traffic. It's really amazing. That's why I wanted to work at Chief Andrew Isaac. That's our goal. That's our primary driving thing is the principle of Schwetzen. I'm not sure if you guys have heard of that before, but it's providing accessible and trusted world-class services with love, dignity, compassion, and respect. And so that's kind of our guiding principle with all things at Chief Andrew Isaac. And I love that a lot of staff members really embody it and embrace it because we're just so fortunate to serve this population. This is our facility. A lot of you may know the new one opened up in fall of 2022. It's a 203,000 square foot facility. We have an expanded lab, OR, urgent care, optometry, an infusion center / cancer care clinic. And then we're getting a new dentist in May, which is super exciting, a new pediatric dentist. So we'll now have 3. So the wait list will come down a little bit for our population. Which is just fantastic. We also have visiting subspecialty care. We have endo, audiology, ortho, and others that are coming in. So it's really wonderful. So our kiddos and their families don't have to travel down to Anchorage as much. We have a CT scanner now. We also just got a FibroScan machine. So for any of you, those that don't know, it's just really
it's a neat machine. It's non-invasive ultrasound, looks at the elasticity of the liver, fantastic for diagnosis as well as monitoring of liver disease. And then we use that for our kiddos who may or may not have fatty liver disease. We use that a lot for our kiddos. We do traditional healing in the form of sound therapy, Reiki, meditation. And then training programs are being created. There's talk of a school even, so that's really cool. All right, something that we're focused on now is an HPV campaign. So we looked at our rates of immunizations, over the years, and the pediatric department was like, it's really better. So we formed a work group in May of 2024. And we really tried to focus on like the 9 to 12 age group, but we included data from 9 to 14 combined here. And so some of the things that we did in order to get our vaccine rates up, we just educated our staff, said, hey, this is why it's important. Here's our immunization rates now. This is why the HPV vaccine is important and to offer at every single well visit. And we changed our EHR alert, which I think is the biggest measure that helped. So yes, education is important, but also just that reminder. So we moved it from forecasting at 11 years to 9 years. So as a reminder for our CMAs to ask at the 9-year visit. That's the earliest you can give. And then we continue to bug patients when they come in, like, hey, do you want it now? Do you want it? And that way we can counsel them. And then back to school clinics. We held 6 at Chief in summer of 2024. There were also a bunch held at our villages. So 4 in Toke, 1 in Galena, Minto and Manly, Nulato and Huslia. And we're doing more back to school physicals. We're in the process of planning those now. And then we're doing letters to families who are due for the kiddos who are due for the HPV vaccine. So those are in process of being sent out. And then our next step is to acknowledge staff who have improved their rates too. So say, good job, like you improved, or you vaccinated this many kiddos with HPV, and having little incentives for them to continue to do so. We're doing something very similar with the MMR vaccine too, with the letter outreach and the staff acknowledgement. Since the work group was formed, we have actually had a 50% increase in our target age group from 9 to 12 of the HPV vaccine given. So that's like huge. So very, very happy about that. And then 9 to 14 overall, not as impressive. It's like 20%, but it's still pretty good. All right. So that's my contact information. Sorry if I rambled a little bit. Feel free to contact me directly. That's my extension right there. That's my email. Any questions that y'all have? No? Okay, cool. Well, it was great being here. I learned a lot from the earlier presenters. Hope you picked up something from me.
Dr. Iser, I loved your slides when they first came in, because the first one of everybody in the crayons and the seat, I was like, that's gonna be a fun place. It was the turtle land. That was the thing.
No, that was my CMA. Yeah, I love her dearly. She is incredible.
I can only imagine the personality, just like flopping on the floor as it.
Yep.
I love
You
that.
know, Dr. Bruner and Dr. Nace are known to come in costume and present at the symposium, but I think that some competition.
Awesome, I'd love to welcome Shelley Point Anderson.
Thank you so much. No, I'm good. I'm just trying to work my push.
Oh, just kidding.
Okay. Well, I will close this out, I think, and I will promise to not be too horribly long, but thank you for inviting. It's been a minute since I've had an opportunity to talk about my favorite subject, and that's public health nursing. So, for all that don't know me, I am Shelley Point Anderson. I am currently the public health nurse manager, and prior to the last time I spoke, I was the state maternal child health nurse consultant. So I've played many roles over the years. I wanted to say thank you to Dr. Bruner earlier, who mentioned that doctors can't do their work without nurses. I was a Fairbanks Memorial Hospital pediatric nurse many, many moons ago. And I also wanted to show one of the other celebrations that's not in the slide. For all of you who don't know, we are still located in the same place that we have been. And last summer, we celebrated 30 years in our building. So if you've never been to the Fairbanks Public Health Center, please come by. We'd love to show you where we are and what we're doing and how exciting we are. So, like Heidi, and we're neighbors. We live right next door to ACCA. This past year, we also have done some strategic planning and looked at our goals, our mission, and we have actually, have come up with a new mission for public health. So, partnering with Alaskans to protect and improve the health and well-being of communities is our new mission. And the vision of the section of public health nursing is Alaskans thriving across generations. And as you all know, we see from newborn baby to lots of elders and in a variety of ways. This is our regional map. And I know it's really hard to see it, but believe it or not, right here in the blue is everything our region covers. So there are a total of 16 public health centers throughout the state. And probably years ago, we had lost a region, but I'm happy to say that we have gained it back. So we're back to 4 regions. We used to just be called the Interior Region, but we are now called the Northern and Interior Region. We here at the health center have 10 public health nurses. I have 1 advanced nurse practitioner whose focus is on reproductive health services. We have 4 office assistants, a health program associate who does a variety of things. A public health nurse aide who works very closely with our nurse practitioner, and myself, along with a regional nurse manager. And then we have a team of itinerant public health nurses, which include 3 public health nurses and office assistant. We also have, who's sitting in the room with us, a preparedness nurse whose focus is on preparedness activities, and 1 of 4 regional preparedness nurses in the state. We have an office in Delta Junction with 1 public health nurse and an office assistant. And we have an office in Toke that currently does not have a nurse, but we're working on it and does have an office. Along with everything that's going on in the health center, oops, I missed one. We also share the office now with we have a disease intervention specialist with the section of epidemiology, and that person is working wholeheartedly on the positive syphilis cases we have in our community and a lot of the other STIs that we see. We have housed the Healthy and Equitable Community Program Coordinator. We have IT people from who knows where that's upstairs. And honestly, I don't know that I have many empty seats left anymore, So with our strategic priority changes, we've looked at our program areas. They really haven't changed much. We continue to work on reducing vaccine preventable diseases, improve the health of children, prevent and respond to tuberculosis and other infectious diseases, reduce sexually transmitted infections. And the one that we have added now is, like I've heard from many of you today, is supporting community mental health and well-being. We're working on how we're doing that. And it's really great to be able to work with all of you to be able to come up with some great ideas. So the health center provides these types of clinical services: immunizations, STI screening and treatment, TB treatment and screening and case management, reproductive health services, which include pregnancy screening, annual exams, contraceptives. And we are doing some well child exams for those who have no health insurance or experience other barriers. So I have, post-COVID, we have new staff. And they have not really had the opportunity to train to do the type of well child myself or Jeanette learned how to do. But I also do still have some seasoned staff that are willing to do that. So if you have folks that need a well child, please, think about us and we will do what we can to get them really safe. We have also looked at what the community needs are. And now we're doing express visits for STI testing. Evening hours, Tuesday through Thursday, we're open until 7 o'clock in the evening. We have walk-in options Wednesdays and Thursdays from 1 to 6 o'clock in the evening. There are no longer any age restrictions. There was a point in time when there were some age restrictions related to reproductive health services. Those are gone. We are sliding fee down to 0. No one is ever turned away for inability to pay. And all our confident and all our team services. So what I'd like to just show you and talk about is some of the highlights we're doing. And the first one is probably for about a year now, or close to, the Fairbanks Health Center is putting out a monthly newsletter. And once a month, we come up with a public health type topic, and it's sent out via email to, 100 people in the community, maybe more. This was the one we did when we had our pertussis outbreak, and just making it simple, a one-pager. So if that's something you're not getting, would like to get, just let us know and we'll add you to the email list. We're also doing staff, what we call our teddy bear clinic. And once a month, staff go into the Children's Museum and they set up this little area with teddy bears or dollies or whatever, and pretend stethoscope, pretend syringe, and they walk them through what a routine medical procedure would be like. And it would be something we do in hopes that when they come to see you, or they come to the health center for immunizations, or they have a better knowledge. Kids love this activity and participated. I think the staff really like doing it as well. And I talked a little bit about our well child clinics. The pictures of the children are staff's children, so we're really excited that they're able to participate. But again, we do developmental screenings, we do immunization, we follow Bright Futures and the American Academy of Pediatrics. And we're prioritized again for families with no health insurance or other barriers. And as a reminder, the health center is the safety net of this. And I don't have to talk much about immunizations. I think everybody's very passionate about it. We know what's going on in this community. We know about measles. I took a call from the school district yesterday about a potential case and just talking through what that would look like or what that would mean. It did not pan out to be measles, but it's just that awareness and working. So all routine childhood immunizations, including flu and COVID, we are doing off-site clinics, school-based clinics, community events. And of course, we still continue to try to provide those point of dispensing clinics that we've worked with many of you in the past and continue to work in the future. We are very, very involved with the school district. We have been in the schools. We don't have enough time left to get in and do all the presentations that we're being asked to do, but we are doing topics like fentanyl and vaping, reproductive health, STIs, hygiene, just all of those types of things that we are going in, and we are doing several presentations. We are going to Presbyterian Hospitality House. We're hoping to get into Graph again soon. But these are things that the nurses are preparing. We are working with, RCPC on those other presentations, and they've just morphed into other things, an ounce of prevention. Best way to go. We still hold our monthly immunization clinic out at the North Pole Fire Department. It's the third Thursday of every month. We send out flyers and have a team that go there. There are folks that come, they're used to us being there, and if there's a need in other parts of the community, we would certainly go ahead and start another type of clinic, much like that. I talked a little bit about our itinerant team. They are a staff of 3 nurses, and they too partner with the schools and communities in over 30 villages and communities across the Northern Interior region. And they're in the Yukon-Quaycut School District, Caltac, Ruby, all of the northern regions. We have a great relationship with the Denali Borough School District. And they just recently, I was talking to one of the nurses about their visit up in Anatuvet and what they did up there. So they're all over. Just the schools, it's just been a really great place for public health nurses to be in. We have the Fairbanks Families Partnership. This is something that was happening and then it sort of stopped. Well, it's back again. It meets at the health center. I believe it's a quarterly meeting. Joanne Spears, one of our long-term public health nurses, has sort of reinstituted this partnership. And so if this is something you're interested in, let us know and come and share your resources if you're not already. This was just last weekend. Myself, my 2 team leaders, were at Mush for Kids. We had a display about measles. We talked a lot about, the importance of being up to date. We had the information about docket. We talked to well over 300 families that came by our booth. Izzy, who's from the immunization section of epidemiology immunization program, was there. Highlights.
Yeah.
And I just learned today I'm inheriting the Izzy costume. So, yeah. I did mention that WIC is now in our building. And maybe one of these days they'll find more or a different space. For now, it's working. Rochelle Crandall is the work program coordinator, and she is seeing clients Tuesdays and Thursdays. And I believe she is available by phone call on other days. But do know that you can refer folks. If they call the health center, we will give them the direct line. And we have been seeing an increase of people coming through the door to provide these WIC services. So I'm really excited we're able to house WIC. And I think with that, not too bad, huh? This is my contact information. If you're interested in more of the itinerant services, please contact Michaela Holt. She is our regional nurse manager. And I'm thinking something. And with that, I say thank you and thank you again for inviting us to the lab.
Are there any questions or anything for Shelley? Well, thank you everyone for all your attentiveness and incredible support. Thank you for all the presentations today. This community is just incredible with all the work that's happening. Before we wrap up, I just wanted to give a little shout out to our Help Me Grow program. If you haven't used this before, we'd love to support you all in the incredible work that you're doing by providing care coordination services, finding resources for families from childcare to medical referrals to family support. And I know that we're referring a lot of you. So thank you all for the incredible work and letting us be your partner. And then PalPac, oh, we also have materials. We will be here next week with over at RCPC with Lee, and we're gonna have a whole slew of materials. So if you would like books, crayons, spelling pages, everything, you can order on our website. They're all free. We love to hand out the books, and we've just got a whole new shipment of them, which is wonderful. So feel free to order some of those books. And then our PalPac services, which is the Partnership Access Line, Pediatric Alaska, which is a child psychiatric consultation program for primary caregivers through Seattle Children's Hospital. So it's a wonderful opportunity for prescribing providers to reach out if they're needing some support around psychiatric services, for clients that they are just needed somebody to reflect with. Talk about, is this the best course of action? Should I try a different medication? So this is a great, we love our partners with Seattle Children's Hospital. And with that, we hope to see you all in Homer, everybody online. Those in the room, if you want to go today, want to take a picture with us, we would love to. Thank you, everyone. We really appreciate it. So if you'd like to take a picture of us, we're just gonna join up here by the screen.
And we do have one
Oh,
more announcement.
thank you.
From here, Bonnie Bailey, you put your title again. The Hail Borealis Forum is May 20th, 22nd in Anchorage, and we'll share out this link. And emergency not talk today, will be participating. So emergency services conference, 3-day conference in Anchorage.
Yes, I was looking at something.
All right, if you'd like to join us, we're gonna take a picture right up here.
We got a great presence.
Just wanted to get up and see, so